Do you want to know how to avoid one of the biggest and most common mistakes people make when rehabbing their total hip or knee replacement? Give me 4 minutes and I'll show you how you can avoid one of the biggest and most common mistakes in the first few weeks after your total hip or knee replacement so you can avoid a possible setback or complication that could completely derail your progress. If you'd like to know more about what you can do both before and after a total hip or knee replacement to get the best possible results, let me know in the comments below and I'll send you a link to our free total joint workshop. I'm Brad Logan, founder of Total Joint PT, and I am your physical therapy specialist for total hip and knee replacement. I have successfully helped thousands of people rehab their new joint after surgery. In every video, I'm going to give you one tip or strategy that you can use to get the best possible results after surgery. So one of the biggest and most common mistakes people make in their first few weeks of their rehab is doing too much. I get it. You want to get back to the lifestyle you want. The typical training mindset is the harder I work, the faster my progress will be. And under normal circumstances, that is most often true. But after a total hip or knee replacement, this strategy doesn't work. Your new joint needs a certain amount of time to establish a solid foundation of healing before it's ready to tolerate normal activity. You may get to a point in the first few weeks where you're not feeling much pain, but your new joint has not had enough healing time to tolerate the activity that you feel like you're ready for. Getting a total joint replacement is a big deal. There's significant trauma to the bone and soft tissue. The bone needs 6 weeks to bond to the implants, and the soft tissue needs 6 weeks to heal enough to tolerate more aggressive activity. I've seen it way too many times where people try to go back to the gym, the golf course, the tennis court, take an active vacation, or just try to mow the lawn way too soon after surgery. Some people get away with it, but several people end up with a setback or complication which can keep you from getting the results you want. You risk things like the hardware coming loose, the sutures rupturing, increased risk of infection, hematoma, or just keeping the joint inflamed from all the overactivity, causing the potential for more scar tissue formation, and that means less range of motion. It's too much too soon, and it's just not worth it. You've come this far. You've invested in yourself by getting a surgery that can get you back to doing what you love. Don't risk the results you want by being impatient and doing too much too soon. Instead, give yourself time to heal. Give yourself permission to take things slowly the first several weeks. During this time, you need to focus on things like walking, basic strengthening to get the muscles to start firing properly, and range of motion exercises to prevent scar tissue formation. The right exercises might feel way too easy, but that's okay. You're giving your new joint the time it needs to establish the foundational healing, which will set you up for much better success at the 6-week mark. That's typically when your cleared for activity is tolerated. Check with your surgeon to make sure your new joint is ready, and then it's game on, time to ramp up. At that point, it's appropriate to get more aggressive with your rehab and start adding those activities you love slowly back into your schedule, like getting back to the gym or on the court. Now, don't go full throttle at first because you still have more healing to take place, but you can increase your activity in much larger increments. Keep in mind the big picture. It takes about 9 months on average for your new joint to fully heal, so don't expect to be 100% at the 6-week mark. At 6 weeks, as long as you don't have any specific limitations from your surgeon, you're typically out of the woods from the major complications that can occur from overdoing it with too much activity, as long as you've given your new joint the time it needs to establish that solid foundation of healing. But again, confirm that with your surgeon. If you'd like to know more about what you can do both before and after a total hip or knee replacement to get the best possible results, let me know in the comments below and I'll send you a link to our free total joint workshop. It's about 20 minutes long and it will give you some great information on how to prepare for surgery and how to rehab your new joint after surgery to get the best results.